Hi, everybody. Sorry to be a little bit late. Welcome to tonight's talk about the path to USMLE Success, or otherwise known as the short version of first aid. My name is Tal Lay. I am the senior editor for First Aid and also for USMLE-Rx and Scholar-Rx. Glad to be here. I'm also an educator and a professor. I'm at the University of Louisville, where I also lead the section of allergy immunology. So, look forward to talking to you folks. We have some great folks here tonight as well too. We have one, maybe two of our fabulous Rx coaches are going to be here to be helping out with some questions tonight. So first of all, I'd like to introduce Sean, who heads up our Rx coach program. So Sean, you'd like to say hello.
Well, thank you, Dr. Lee. Hello, everyone. Sean Nanji here, working with Rx coaches, students like you and coaches like Paul Russ and others that will hopefully join us later, working with you individually one-on-one through coaching and tutoring to help you maximize your potential while in medical school and on your boards, and looking forward to answering your questions tonight.
Great, fantastic. And when Paras joins, we'll introduce him later. But anyways, let's get right to it. From a housekeeping standpoint, you will be able to ask Sean and Paras questions. Just go to the question panel that's in the right side or of your screen. If you're on a PC, I think Macs do it the same way. If you're on a iPad or a tablet or your phone, it's in the menu bar, and we'll do our best to try to answer questions. We can't be we can't be too specific just because we don't know you. But we certainly would love to help, and that we'll let you know how you can connect with an Rx coach after to talk further for a deeper dive. But we'll definitely try to answer high-level questions and provide some general useful advice. Okay, great. So let me get started. So the first word in first aid is relax, and I think now with USMLE Pass-Fail, I think we can relax a bit more. But we've always counseled that this exam is really about a marathon, not a sprint. And so we want you to again relax, take the long view, be really deliberate in how you think about and prepare for the exam. And so we'll take you through that process. And as part of that process, we'll provide some basics. We'll help you think about your goals or how the USMLE is being used, and so talk about USMLE updates, which there has been obviously a ton of in the last several months. So we'll get you up to speed there. Talk about setting up your timelines for studying approaching subjects, prep resources, some general study advice. We'll give you an update on what's going on with Rx Coach and Bricks, and we've got a raffle and some special offers. So stick around, and maybe you'll be able to get a Rx Coach package, and also be able to get access to our Q banks and Bricks and so forth through Rx 360. We'll talk more about that, and then we'll open up for some Q&A at the very end. All right, so let's dive in. So the first thing I want to do is ask a couple questions. I want to know more about you folks. So I'm going to open up this poll here and ask a question, which is very simple. Who are you? Are you a U.S. medical student, osteopathic, allopathic? Are you an international medical graduate? And were you U.S. born or international born? So we can get a sense of who's out there tonight. So we'll give it a couple of seconds. Once we get some results, we'll share it with the group. So looks like the majority of folks have voted. I'm going to go ahead and close the poll and share the results. And what you see is that most of you folks are international medical graduates or or studying internationally, and then there are some U.S. students, in the room. So welcome everybody. It looks like it's going to be a very global audience tonight. Look forward to discussing further. Let me go ahead and ask a follow-up question, which is, when do you plan on taking the exam? Is it pretty soon, in the next couple of months, or is it later on in the year? So go ahead and select something that select what best suits you. Even if you don't know, when do you think you might be taking the exam? And so we'll leave this open for 5-10 seconds so you can register a vote. All right, votes are coming in. Looks like most of you have voted, so I'm going to go ahead and close this and share the results. And what we see is, there's a bit of a bimodal thing. We've got some of you folks are going to be taking pretty soon. That's no surprise. The summer boards are coming up. That's a typical season. But really, the majority of folks are going to be taking in September or later. And big chunk of you guys won't be taking until next year. So again, a fair number of you folks are planning ahead, which is great. So all is good. And even if you're taking pretty soon, hopefully we'll be able to provide some additional advice and some quick tips. All right, let's get back to the presentation. We're gonna now talk about the basics of the exam. It is a one-day exam, 8 hours in total to be exact. You will have 280 questions in 7 one-hour blocks, so 40 questions per block. Each block is, as I said, an hour, so that means there's 90 seconds per question. You have about 45 minutes of break time minimum. But if you think about how it's set up, the first block is actually not an exam block. It is an orientation block, and then you can see the 7 exam blocks here. And you're given 15 minutes of time to go through that. But if you think about it, it's the same orientation you get if you download the software at usmle.org. And so if you do that orientation block ahead of time, as part of your normal prep with a free 120 or whatever, you can, and then if you go into the exam center and only go into this orientation block just to, use it to adjust the audio volume on your headphones for the handful of multimedia questions, you should be able to get close to an additional 15 minutes, and that goes to your break time. So most of you should be able to start off with close to an hour. And we'll talk about how you get even more break time if necessary. All right. So let's talk about the exam itself. It really only has one question type, which are the single best answers. So there's no true false or no multiple select or K-type questions where it's A, B, A, B, C, A or C. Those types of things. Those are long gone. Most of the exam is scenario-based or clinical scenario-based, or at least lab scenario-based or something like that. So and they all and the majority of the items will have what we call multi-step integrated reasoning. So it may represent multiple disciplines, like a clinical presentation, path presentation, and then they're going to test you on the genetics or something like that. So here's an example here. A 32-year-old woman presents with a 5-day history of occasional double vision and bilateral ptosis. What is the most appropriate diagnostic test, right? And so when you work your way through that STEM, you realize that this is actually not a one-step question. This is actually a 2-step question, because the first the first thing you're going to want to figure out is what's likely going on with this one. What's the presumptive diagnosis, and the most likely diagnosis. And so you think about it with this person, with the laggy eyelids and the double vision, it's most likely going to be something like myasthenia gravis. You can think of something like multiple sclerosis, but it tends to have more asymmetric or unilateral findings. And so if indeed this is myasthenia gravis, then what's the most appropriate? That's step 1. And then what's the most appropriate diagnostic test? That's step 2. And in this particular case, this will be acetylcholinesterase receptor antibody assay. That's the state of the art now. If we asked this question 4 or 5 years ago, the answer might have been, edrophonium challenge, which is a short-acting, acetylcholinesterase, a blocker, and also known as the tensilone test. But it's mostly gone, and though some countries still use it. But that's again an example of a two-step question. You'll see plenty of these on the step 1. You may see some 3 steps as well too. Some 1 steps, single step questions, mostly around something like diagnosis. And so one of the key themes that you're going to hear me continue to stress through this presentation is that you got to learn to integrate these various steps together. So integrate the pathology with the genetics, with the cellular molecular biology, bio issues, with therapeutics, with the drugs and so forth. So you got to like link it all together, right? And if you think about how it works in the real world, that's often how you do it when you make a diagnosis and you think about underlying mechanisms and then prescribe a treatment course. All right, so let's talk about the interfaces exam itself. It's very straightforward. You'll get a simple interface with and you'll see here is the stem, which is the case, and then this is the lead-in, which is what is the question they're trying to get at. You will have a minimum of 4 choices. Most of the time you'll have 5, and occasionally you'll have 6. Rarely 7, and about 10 to 20% of the time you will have some sort of visual information. So they may be showing some histopath like you have here as part of the case presentation, or there may be a line diagram or a graph or maybe some lab data, like they may be showing you some flow cytometry, scatter plots, stuff like that. So you may end up having to interpret it. You got navigation on the top, navigation on the side, your timer's at the bottom. You can lock the exam, but the timer will keep going. And then when you end the block, then you exit. Now the key thing is, while you're within a block, you can go back and change any of your answers, and then when you exit, you cannot go back and change in the answers. The other thing to note is that, again, you are given 60 minutes. If you finish your block early and then exit, anytime that you have left over in this block then goes over into your free time. So that's actually how you can get additional free time, for breaks, stretch breaks, lunch or snack breaks, that type of stuff during the daytime. All right, let's talk about scoring and passing. So as we all know, the step 1 went pass fail about 3 months ago. But you still need to be aware of the numbers, for a couple of reasons. One is they did, the pass fail threshold did rise a little bit from 194 to 196. So that means there's, the exam is now a little harder than it was before the score change. You'll still get that pass fail adjective, they just won't give you a score, but if you pass, you know that you did at least 196 or better, right? Until they were tracking scores, last year the mean was 231, the year before that was 233. It bounces up and down. The standard deviation, if they were to report a score, would be around 20. With regards to pass fail, for allopathic, osteopathic, most students will pass it on the first try, and almost everyone passes within 3 tries. For IMGs, the numbers very high 70s, low 80s, and also it really varies depending on what school you come from. But on average, it's going to be a little bit lower, so it's going to be a little more challenging. But again, in our experience, most IMGs will pass within 3 attempts. With regards to USMLE percentiles, again, this is more of a historical thing now, but I think it's worth noting that again, it's really we expect at least first-time test takers on average, if you average everybody together, 6% or so, 94% will pass, on the first try. And if they were to give you a score, you'll notice that it flattens out at around 270. So it's rare to see people with scores above 270, 275. All right. USMLE is a screening tool. This is the big deal, right? It used to be that step one was used as a screening tool for by residency program directors, who were overwhelmed with applications particularly at competitive programs in competitive specialties like radiology, ortho, opto, and you can see it's all all in this mnemonic road here, right? Aesthetic, which is plastics, dermatology, right? So they used to, if you were, for the M3s who took it last year, for example, they will, the schools will still be using that, but more and more they're going to be using the step 2 as a screening tool. And so one of the things that, one of your goals, obviously not just to pass, but also to set you up in a good position to, excel, do well on your USMLE Step 2 CK, right? So you literally, no pun intended, you need to think about this as the steps to the next step. All right, so let's get to those USMLE updates. Again, there's a ton here, so that's why there's a lot of updates here. We already talked about the pass fail. We already talked about the scoring going to 196. Not only is USMLE, but also the sister tests like the CBSEs, the CBSSAs are also no longer reporting, a scaled score that used to go from 200 to 800. But they will report on a probability of passing the exam and overall percentage correct. And again, historically, and I don't know this is every exam, they're going to, normally you would need to score in the 60% or in the mid 60s to safely pass the exam. It might have turned a little bit just because of the pass fail, but but that's this historical number. USMLE Step 2 CK, for those of you who are thinking about that, they also changed their standard. It was just the pass fail standard from 209 to 214. It will take effect in a few months. So that exam is also getting harder. And then for the osteopathic students, that level 1 exam will go pass fail in about a month or so. So lots going on. All right, study strategies, right? So how do you study for exam? So the good news is that most of you have taken high stakes exams like MCAT or SAT or the equivalent where you studied in your country, and so you're used to preparing for these exams. That being said, keep in mind that the structure and the characteristics of the subject may impact how you study. For example, pharmacology has a repeatable rubric or framework in terms of how the concepts relate to each other. Same thing with micro and so forth. And so those things you can kind of use tables or flashcards, to kind of nail, because it's not really about understanding the relationship, because that's understood. It's once you understand the relationship, what is specific to that drug or to that bug. You also need to understand the strengths and weaknesses of your curriculum, and with regards to how well it prepares you for exams like the USMLE. And there, your upperclassmates, the upper class folks should be the best source in terms of, yeah, hey, our school is strong in pharm, but we can micro, and so you might want to, have additional resources there. And then finally, time assigned to a particular subject or system. Almost everybody's going to be preparing for PATH, and you're going to be spending loads and loads of time there. And so you may be able to, have more spacing and experiment with more study strategies there. But when it comes to something more, finite, like neural anatomy or, biostats, they're going to, really test a more limited set of concepts. And so there, you're going to spend less time, and you're going to stick with the true and tried, like doing Q banks, doing first aid, doing some flashcards, stuff like that. Whereas otherwise, you could be doing more like case studies and so forth. All right. Next, what I'm going to do is I'm going to spend 5 to 10 minutes talking thematically about what's generally high yield in all these subjects and disciplines. Now, obviously, when I talk about discipline like anatomy, it should apply across systems like cardiac anatomy or GI anatomy and so forth. And again, you're going to see a couple of recurring themes. I'll hit them pretty hard as I go through it. I'm not going to read all this because, number one, it's on my blog. You can go look at it anytime. And also, I've given other talks where I go a little deeper, and so I'll show you where all that is. But so here I'm just going to really focus on the themes. So with anatomy, again, one of the big themes is they're going to really be testing you on things that actually have some clinical relevance. I know that that might sound slightly counterintuitive because they call themselves a basic science exam, but but because it's almost all clinical vignette scenarios, they do try to give you somewhat authentic clinical scenarios, though simple or simplified, where this stuff can show up. And so you need to understand the clinical context in which some of these issues are tested. For example, they're not going to just say, hey, look, what is the? They're not going to ask you, hey, what's the motor and sensory functions of the median nerve, right? In your hand. They're going to say, oh, patient comes to the emergency department, has a spiral fracture of the humerus, and then you're going to have to figure out, oh, they have a spiral fracture of the humerus. There's a nerve that goes to the humeral groove, and if that's severed, then what would be the resulting sensory and motor deficit, right? So those are how these things will show up, right? As I mentioned, there are going to be some subjects that will be more restricted. They're fairly well defined. If at least you're trying to pick up the low hanging fruit, there's always a chance that they can go after something picky or whatnot. That's always the possibility. But it tends to be more restricted, and unless you're trying to completely get everything right, which you don't need to, you can turn your focus elsewhere. The other thing to think about thematically is that things that showed up in the cadaver lab are not going to show up on the test, because this exam is still about patients, right? These are patient scenarios, and most of the patients you're dealing with are live. I don't know. I don't recall they actually have cadaveric or path type. But it's rare that that they would be showing you cadaveric anatomy. It's going to be showing up as CTs, MRs, X-rays, and so forth. So you need to know how this stuff clinically presents. All right. Biochemistry is one of those crammable areas, and there are a couple of those areas that are crammable. Because why are they crammable? Is because the relationship, the conceptual relationship between all the facts you need to know are recurrent. Like biochemistry, particularly with pathways, it's about the substrate, the results, the enzymes involved, what induces the pathway, what blocks the pathway, that type. So it's pretty straightforward, and so there's not a lot of conceptually you have to keep figuring out every time you learn a new fact or concept or master a new concept. In biochemistry, and to some extent, kind of the relevant area of lab medicine, you will see lab techniques like show up where you may have to interpret plots, gels and scatter plots for like things like, again, flow cytometry and whatnot. And so be familiar with how they present, and because number one, a lot of this stuff is being used in lab medicine. Number two, there's going to be some science-based scenario where you are playing the scientist and you have to figure things out. All right, microbiome immunology, also crammable because they like to hit on a series of recurring related concepts like how is the bud presented? What are the distinction characteristics? How did they get there? Where did they go? How did they get there? How do you diagnose it? What are the reservoirs? What are the vectors? What's the treatment? That type of stuff. So it tends to be, conceptually straightforward. It's just really then, being able to memorize and contextualize, those facts. Remember that it's not all bacteriology. There's a lot more to it. And then, remember that in immunology, it's not about just memorizing arcane, complement cascade pathways and this, that. They want you to think about how it works in real life, how it works, with immune deficiencies and vaccine, and oh my gosh, with the pandemic for the last 2-3 years, it's been one big case study on the, on the effectiveness and the need for vaccines. All right, pathology, as you know, as I said earlier, is huge. Everybody has to prepare for something for this, and there, a couple of interesting things. One is, in general, they're going to give you, fairly straightforward presentation in terms of not like, trying to flood you with tons and tons of details. Sometimes they can, but it tends to be moderate. Now, the actual presentation itself may or may not be classic for that disease, especially if it's a common presentation like asthma, for example, right? So, we all think shortness of breath and wheezing with asthma, but particularly in pediatric population, you may have some patients, some kids that just show up with a cough, and so you might think all they got is a URI or just a little runny nose and allergic rhinitis, but it could be pediatric asthma, and of course in adults there is something called cough-bearing asthma, so it does happen. The USMLE has been, I think, evolving, with regards to addressing issues of implicit racial bias, and in how they're using, gender and age and so forth. So they tend to use it, if they put it in there, it's either, it can be irrelevant, but if it's relevant, just keep in mind that not everything presents like the textbook, and not everything presents in the classic way, right? For example, you may have been taught, certain conditions, like sarcoidosis, right? Black female, maybe younger, but guess what? White guys can get it too, right? So sometimes, you end up psyching yourself out. They're not actually trying to fool you. I mean, it's totally legit to give you a white guy with sarcoidosis. But just remember that, in the white presentation, not, there aren't that many pathognomonic relationships between age, gender, sex, and the disease condition. The other thing to think about is the buzzwords. So you should see buzzwords on the boards like double bubble sign or Saturday night palsy. So they won't be using eponyms either, like Ross spots and stuff like that. They're going to describe the finding, or they're going to describe the thing in using generic language. So you need to be able to recognize that, and you'll get the hang if as you do more board questions. And then finally, with regards to imaging, again, it's going to be clinical imaging mostly that you're going to see, and do show up with path, though not all the time. And our advice there is that you need to, when you're dissecting the question, and by the way, if you're interested in dissecting, do come to our question labs. Our arts coaches do that as a public service every month or every other month. You can, when you go through our 7-step process, we tell you, that you want to look at the photo imaging, after you get to the stem, because if you do it before, you're not going to be able to contextualize it properly. And again, the other thing we'll mention is that the majority of the time you can actually figure out the question a lot of times without even factoring that in, which is a good thing because occasionally they will give you imaging that is hard to interpret. You can't tell from the stain. As you know, H&E stains can have like 30 zillion different shades, right? All right, pharmacology, also crammable because of a regular conceptual framework in terms of how they think about mechanisms and toxicities and so forth. Just FYI, they don't test treatment anymore. We do cover those in first aid. We do that because we think that's just good to know because you're going to be taking care of patients soon, or you're already taking care of patients. But they're not testing treatments on the USMLE Step 1. But they are testing other things, right? And so for mechanism and toxicities and class effects, you want to at least cover the prototypic drugs and the major variants. Unless you really want to, and there's no need to. You don't really need to do too much on the derivatives or the minor stuff. And the trade names are only helpful as a mnemonic. They're not gonna be using that, obviously on the USMLE Step 1. And because it is about therapeutics, it's almost always going to be integrated with something else like pathology or so clinical presentation or with the physiology or the cellular molecular biology, especially if the drug works at that level. All right, physiology is different than the other ones. This is not crammable because it's concept oriented. So the renin, angiotensin, aldosterone pathways are going to be different than the HPA, hypothalamic, pituitary adrenal pathways, and the relationships are. So all you know is that they're pathways, but what they do and how they interact with it is all different, right? So you really need to conceptually understand and be able to apply them. And so diagrams work, mind maps are helpful. And again, almost all of them will be case-based pathophysiology. Psychiatry, this is shorthand for a mix of things you'll see, like that includes psychology, sociology, psychopharmacology. We often think about the mood disorders when we think psychiatry, but remember there's all kinds of other disorders like personality disorders and so forth, and we do cover all the key ones or at a high level in first aid. Public health. There's been a ton of change here in the last couple of years. It started several years ago where they started putting more about quality improvement, safety there. Biostats, epi, ethics always been around there. But then in the last couple of years, they're putting in more population health, more patient communications, especially. That came into the exam 2-3 years ago, and so you can see, like in our question bank, we have at least 100, but close to 150 questions that deal with doctor-patient communication, conundrums and how to respond to patients in an effective and compassionate way. All right, so that was a quick walkthrough there. And again, there's you can get a copy of this presentation on our blog. I'll show you how. So again, you don't have to sweat all the details. Now let's talk about test reviews or test prep reviews. So there's a ton of stuff that's out there. You're familiar with most of these things. There are text reviews like first aid, test banks like USMLE-Rx, and videos like RxPress and other stuff. And then there's digital flashcards and the review flashcards, physical flashcards. Obviously, you still buy those, but most people do digital flashcards. And then lots and lots of review courses out there as well too. Some in person, some a lot virtual. So with all these things to choose from, and with really limited time and limited budget, as a student or in an IMG or IMG, what are you going to do? Well, we do have in first aid resource reviews. Think about it as consumer reports, for test prep. We do it as a basic service. You don't even have to pay for it. You can go to our blog and get the latest reviews, and I'll show you where. In first aid, we just give you the abbreviated scores and so forth as a quick reference. But for the full review, go to firstaidteam.com, our blog, and I'll show you where you can use it. And then you want to start using these resources earlier rather than later. Use it along with your coursework, with your classes and stuff like that, so you get used to them. And then don't overbuy. Most of these resources, the high yield ones, are on-demand digital resources. The handful of books that you may be getting, Amazon will get you there, right, most of the time, or Barnes and Noble and whatnot. And then just remember that, not everything is good at everything, right? Some resources are great at pathology and others are great at micro and so forth. So you gotta be discerning, as you're looking at each of the disciplines. So with that, what I want to hear from you is, we're going to pause here and wake you guys up. I'd love to, hear about what type of resources that you're using to prep for USMLE. So I am going to throw up a question here. This is a multiple selection. You can choose more than one. What are you going to be using to? What are you using to prep? Is it question banks, review books, flashcard, mobile apps, or all of the above, or video, or all of the above, right? So think about it for a second and click all that applies. We'll give you guys 10-15 seconds to answer. All right, looks like close to half you folks have responded. We'll leave it open for a couple more seconds to get a couple additional responses, and looks like most folks have responded. So I'm going to close the poll and share the results. And what you see is, not a surprise. QBank's #1, review books and videos, essentially tied #2. Fair number of you folks are using flashcards. Some of you are using it as a mobile app, and mobile apps are pretty good for like quick study, but obviously not so great when you're trying to really dig into a topic. You need visual space, right? So a lot of you guys are going to be doing on your laptops or your desktop computers. All right, so let's go ahead and continue. So some general study advice here. Again, obviously Rx coaches are going to be really helpful, but if you talk to them, these are some of the things that they may talk to you about. Obviously, they'll customize it, for your particular needs. But at a general level, you want to think about your schedule ahead of time. We do have a free study schedule, and you saw that Jeff dropped that into the chat. So do check it out. It's based on first aid, and it'll help you with organizing your study. You want to integrate and apply everything. Again, that was one of the themes that I talked about earlier, right? So integrate. And it's going to be also very important when you get to step 2 CK, right? Because there, most of the questions are at least going to be a step 2 question, right? Because the majority of them will not just ask about diagnosis, but then they're going to be asking about treatment or complications or underlying mechanisms and so forth. So get used to multi-step questions and get used to being able to integrate. I mentioned that there are crammable subjects. Again, let me just stress, we don't think you should cram. Cramming is not a good thing because it's while it may be easy in, it's also going to be easy out, easy to forget. But when you're at the end of a marathon, you will see that those marathon runners will sprint the last mile, right? Because at that point, they can build up some exercise debt, and they'll pay for it after they get to the finish line. But they can do that. So you can do that a little bit too. When you get into the last week or two, for some of the crammable stuff. Remember that this exam was designed to test your knowledge and competencies over the first couple of years of medical school, right? So definitely do study the stuff that you learned before, and and use first aid as a guide to help decide what to focus on and what not to focus on, and that will get you far down the road. The other thing, is really about organization to deliver plan, right? So one, don't run yourself into the ground. Do not burn yourself out. You got to pace yourself. You got to keep a high energy. You got to keep, you got to, not go down rabbit holes and so forth. Make sure you can step away from this. And even if you're in a dedicated study period, where you're doing this, all week or whatever, take at least one day off, to do something else, be with family, whatever, exercise. And the other thing I would say is that, as a corollary, make sure you get through your at least your primary passes, a week or two before the exam, so you have some time to, make decisions about what you need to go back and remediate on, right? We have a checklist. Again, it helps you with really planning and taking the long view. So again, this is where it helps you stay relaxed and grounded. So that's some advice that you might hear if you talk with RX coaches. But hey, let me ask our RX coaches directly. Sean, any other thoughts? When you are talking to students and IMGs about general advice that they could use.
Well, actually, thank you, Dr. Lee. Great timing. We actually just had a student ask us, should I take an assessment before I start studying for the STEP? And that is one thing that we do as part of our coaching program, and we recommend that all of you do as well. A lot of students are a little tepid at taking those assessments at the beginning because they're worried about the score. Remember, the assessment is a tool. You can use it to really guide your guide and plan your study process. So don't look so much at the score always. Look at the different subject areas and see what your strong areas are, what your weak areas are, so you can focus accordingly. And of course, take assessments periodically to gauge your progress. And like I said, and like we always tell our students, if you want somebody to take the guesswork out of studying, to help you create an individualized and personalized study plan, so that you're not just listening to what your friends said or what you read on Reddit, because everybody is so different, reach out to us at rx-coach.com. Click on that free consultation button. We'll talk about the program and see how it can benefit you.
Great, fantastic. Appreciate all those insights. Let's keep going here. Computer-based testing tips. That's what CBT stands for. You may see that. You'll see that acronym when you're going through all their instructions, right? So as I mentioned, there's a tutorial at the beginning, and so you want to do that before you actually get to the test center. There's some keyboard shortcuts that may or may not be helpful. Most of you won't use it, but a handful will find it useful. To navigate and answer questions. And then key thing about CBT and as we talk about evidence-based study techniques, is you want to do lots and lots of questions, and this is backed by science. As seen here, there was a study about 10 years ago published in the journal Science. It was reported at the New York Times, and basically what they found is that people who self-tested, if they randomized students to self-testing, those students did better versus people who just crammed it repeatedly versus other study techniques, even if everybody had the same amount of time to prepare. So self-testing is superior, even if it comes to complex, questions. All right, and what are the self-testing options out there, right? Well, there is the USMLE sample test called the Free 120. It's helpful for format familiarity. It may not be up to date with the types of stuff that you may see, it may look a little thinner, a little easier than what you might see on the actual USMLE. There's the NBME-CBSSA, that stands for the Comprehensive Basic Science Self-Assessment. It's helpful for benchmarking. Again, as I said, it's about 50 to 60 bucks. You get it for about 2 months. It has about 200 items in it and about 4 blocks, and then you can go through it to when you get through it, it'll as we said, gives you a percentage and then probability of test passing, and they should also give you a kind of a histogram of your strengths and weaknesses as well. QBanks like USMLE-Rx, like UWorld and others, they're good for practice, for study, for simulation, and we'll also kind of give you a predicted, where we think if it was scored, what your pass-fail range is. And for us, as long as because we're estimating, plus minus 20, we have a pretty good tight confidence interval. As long as you're scoring above 220 or roughly 220, on our simulated exams, you should be pretty safe. All right, at least for passing. All right, so let's talk a little bit more about what the research says. This is what the science says, and what I'll say something, because I also read what students are saying on Reddit and saying on YouTube and whatnot. And I just want to echo what Sean says. What worked for them worked for them. It may not work for you, and they are not a randomized blinded study. And a lot of the ones that are telling you what they got, the majority of them would have gotten a good score almost no matter what they did. As long as they put in some time. So so just keep that in mind. So what does the evidence show? What does the actual research show? One, question banks are better than flashcards. All right, so no duh, you say, and obviously that's what most students will say, right? Because the question banks are going to look a lot more like the real stuff versus how a typical flashcard question is constructed. Number two, how many questions do you need to do one additional point on the step one? There's actually research on this, and there's multiple studies. Fortunately, they repeat each other, and so it's usually between 300 and 450 questions to get one additional point on the step one. Now, how many questions do you need to do to prepare the exam? Again, because it's pass fail, you may not need to do as much, but the bottom line is that there does seem to be a dose-response relationship. So the more questions you do, the better performance, or otherwise, the higher probability of passing the test is. So in the study published out of University of Michigan, students who did 3,200 MCQs generally did better than those who did not. This is a piece of research that contradicts what is popular conventional wisdom, which is do certain question banks 3 times, and then that's all you need to do. That's not what the studies show. What the study shows is that you need to have fresh questions all the time, and it's actually doing fresh questions that gets you the higher score, or in this case, gives you the highest probability of testing. Why is that? Well, there's a certain phenomenon in learning called fluency. What fluency means is that you study something and you feel like you felt like you learned it, but you really didn't learn it, right? So how does this actually work here? So if you repeat an MCQ and then you go in and you get it and you feel great, first of all, you feel great. But then if you were to come back and analyze it, you may or may not have gotten it for the right reasons, right? You may have gotten it because that person with asthma, showed up, was wearing, I don't know, a red turtleneck, right? And it was really the red turtleneck that tipped you off, because that just seemed a little unusual. But it has nothing to do with the clinical presentation and how you make the diagnosis and then think about the pathophysiology. But then you make this erroneous connection. So that is an example of fluency, right? And so again, do unique questions, and you may say, well, that feels more uncomfortable, but hey, the analogy there is it's kind of like doing weights, right? Or running, right? You don't feel great when you're lifting weights, and you don't feel like you're making progress, but then later on when you check, the circumference of your biceps, or you check your running time, you realize that you made progress. So that's kind of like the no pain, no gain school. And in learning theory, we call that desirable difficulty. You want it to be difficult, and you want it to be challenging, and you do not want to be given a pass. The last thing is that first aid is actually helpful. That's actually been proven. We didn't do the study, so we're just quoting other people's data. But out of the University of Michigan, they found out that students did significantly better if they went through first aid 3 times, especially using active learning techniques such as doing first aid as flashcards, right? And of course, we actually have in USMLE-Rx, all of first aid as flashcards, so you can read it, you don't have to write it out. And plus, by the way, when you get the answer, we'll link you directly to that page in first aid, so you know exactly where the answer was, regardless of whether you got it or not, so you can decide how you want to remediate that. All right, last thing to think about here is test day itself. A couple of things to keep in mind. Most of you are going to be jacked up, so think about cutting back on your caffeine that day, especially if you depend on it to get out of bed. Think about the office environment. Most of the prometric tests that are in these offices, they are environmentally controlled, and they tend to run code. Occasionally, you might run into something where you might get direct sunlight, and so that might be bothersome. So dress with layer clothes so you can adjust up and down. I mentioned earlier that the majority of the stems are moderate, but there are times, and you may run into blocks, where holy cow, it looks like all the stems are like are Tolstoy novels. Hopefully not, but they can get chunky from time to time. And so if that's the case, like I said, use our 7-step dissection method. Either learn it from our coach or go to our coaching one of our coaching question dissection lab webinars, right? And we'll take you through that. And as part of it, you're definitely gonna, we definitely want you to, look at the lead-in before you go through and dissect the stem, as part of it. There are variations on this, and but we think that most variations of question dissections should have you do the lead-in first, particularly if it's a long step. Again, the clock, the clock can sometimes, be a challenge. Again, 40 questions, 90 seconds, 40 questions an hour, which means 90 seconds per question average. We advise that you try to lock down, your best answer within 75 seconds. The reason you do that is then you will have after you do 40 of these things, you'll have about roughly 10 to 12 minutes left over. And if you mark, the solvable questions, that I would mark no more than 10, to go back solve, then you can use those 10, 12 minutes to try to see if you can narrow down the choices anymore. Again, you might have heard of this common wisdom that you should never second guess yourself. Wrong. The data shows that that actually second guessing is more effective than just going with your first hunch. Now, again, mileage may vary. Most question banks, including RQBank, can give you the tally of what happened on your second guess and this, that, and the other. But on average, the research shows with USMLE, with SAT, with other exams, that if you can have extra time, second guess does give you a bit of an advantage. So we talked about snack breaks and this, that, and the other. The key thing here is at some point you're going to have to take snacks and this, that, and the other. We advise that you think about doing a one-day simulation. So you can go. USMLE-Rx is the only one that lets you do this. You can set aside 280 questions to do a full day exam. So if you do that, and it gives you those time blocks, then you can figure out where your energy level is. So you can say, okay, I'll do 2 blocks or 3 blocks before my first break, and I'll take 2 breaks or 3 breaks. And so you can decide, how to, strategically schedule that so it comes when you need to re-up your energy level. The last thing is kind of a bit of a joke. In my study group in med school, we have this thing called the C reflex. As you know, you have some of these airway nerves called C fibers. So, haha, there's the med school joke. And again, but the idea is that you will run into some questions that are really easy. You're going to run into questions that are difficult, and you're going to run into some questions where you're going to have no idea what's going on, or they're just crazy insane. And you won't be able to narrow down the 5 choices down to to anything reasonable. So if that's the case, pick C or B and move on. Interesting to note that on the exams there are several, if not dozens, of items that are what they call experimental or kind of diagnostic items. So they're not there to be graded. They're there to give information about the performance of that particular version of the exam, of which there are dozens and dozens. And so they want to make sure that all the different versions of the exams are equivalent, even though some are subjectively harder than others, and some subjectively are going to be overloaded with something, with some topics, and underloaded with others. So they got to make sure that it's all like psychometrically equivalent across the board, right? And so there's a couple, there's a couple dozen items that are there for that. Some are experimental. So if the item makes no sense or you don't get it, just hope it's one of those experimental items. Take your best guess and then move on. All right.